Hello friends, I'm back again with new video, and today we're going to discuss about clinical signs of liver failure. We're going to discuss signs of liver failure by dividing the body to different parts, discussing them over face, upper limb, chest, abdomen and lower limb. Let's start. So, the clinical signs, starting with the facial signs. They are icterus, KF ring, xanthelasma, parotid swelling and spider nevi or spider angioma. So discussing them one by one, icterus is one of the very important signs of liver failure. It occurs due to inability of the liver to convert the unconjugated bilirubin to conjugated. This results into increased unconjugated bilirubin, causing jaundice, and which is visible as icterus in the upper bulbar conjunctiva. Another sign is KF ring or Kescher-Fleischer ring, and this is seen on the eye, which is a brownish ring-like structure in the cornuscular junction of the eye, seen on split lamp. This is a typical sign of Wilson's disease, and if a liver failure or a liver cirrhosis is caused due to Wilson's disease, we can see a KF ring on split lamp. Another important finding on face is xanthelasma. We can see a xanthelasma here. It is a yellowish deposit of fat under the skin around the eyes, and this fat deposition occurs in liver failure, especially in the chronic alcohol use, because chronic alcohol use results into hyperlipidemia. This occurs as in this image we can see the alcohol metabolism. Ethanol is converted into acetaldehyde and acetaldehyde to acetate. In both of the reaction we can see that NAD plus is converted into NADH. This results into decrease in NAD plus and increase in concentration of NADH. Both decreased NAD plus and increased NADH results into hyperlipidemia and fat accumulation. So in the alcoholic use there is fatty liver change, and this fatty liver change as well as there is hyperlipidemia, which is manifested as xanthelasma in eye. After xanthelasma, another important sign in face is parotid swelling. This occurs as a result of sialadenosis of the parotid gland. This occurs due to chronic alcohol use. Sialadenosis is a chronic, bilateral, non-inflammatory, non-neoplastic swelling of the major salivary gland, and that is parotid gland involvement in this liver failure. Another important sign in the face is spider nevi or spider angioma. Spider nevi is an isolated telangiectasis that characteristically feed from the certain feeding vessel in distribution of superior vena cava. So spider nevi can occur in face, upper trunk, arm, which are the distribution area of the superior vena cava. This occurs because of decreased estrogen metabolism that occurs in the liver. So there is increase in concentration of the estrogen in circulation. Hence, in pregnancy, spider nevi can be seen normally as there is increased estrogen level physiologically. Now let's discuss about the chest sign. What are the features that are seen in the chest in liver failure? They are gynecomastia in male, breast atrophy in female, loss of body hair, and spider angioma as we discussed just now. All of these four features occurs because of increase in estrogen level in circulation. Now, hand signs. In hand signs of the liver failure includes palmar erythema, clubbing, leukonychia, hysterexis, Dupuytren contracture, and jaundice. Let's discuss on pulmonary erythema. Pulmonary erythema occurs as a result of increased estrogen concentration, as we discussed for other features in other different parts. So, in pregnancy, normally a pulmonary erythema may be visible due to physiological increase in estrogen level. So, another important finding in hand is clubbing. Another one is leukonychia, and leukonychia occurs due to hyperalbuminemia, as albumin is synthesis in liver. So the synthesis of albumin is reduced due to liver failure. Another one is hysterexis, or it's a flapping tremor as a result of hepatic encephalopathy. Hepatic encephalopathy occurs because the act of detoxification that liver does is not successful as a result of liver failure. So the toxins that are accumulated in the blood enters the cerebral circulation, resulting the toxins in the brain, especially ammonia, results into the hepatic encephalopathy, which is manifested as hysterexis along with drowsiness, decreased consciousness level, and this can even result up to coma. Another important hand sign is Dupuytren contracture. It is a contracture of the palmar fascia linked with chronic alcohol use. This results into permanent flexion of one or more of the fingers. So at the last, it's jaundice, which is even visible in the hand. Now the abdominal signs of liver failure, they are splenomegaly, hepatomegaly, ascites, caput medusa, and even the distended veins over abdominal wall. All of these features are due to portal hypertension, which is a result of liver failure or liver cirrhosis. The signs in the lower limb is bleeding tendency. Bleeding tendency occurs as a result of failure or formation of coagulation factors. This prevents the coagulation normal physiology and hence bleeding tendency. Ankle edema can also be visible due to hyperalbuminemia. Hope this video was helpful for you guys. Thank you for watching. Bye bye.